Prime Minister Rimtalba Emmanuel Ouédraogo made a field visit on Saturday, August 2, 2025, to inspect the construction progress of the Regional University Hospital Center, CHRU, in Gaoua. The project, occupying a sprawling 25-hectare site in the Tonka district of Gaoua, marks one of Burkina Faso's most ambitious healthcare infrastructure initiatives. Commissioned by the national government and entrusted to Ellipse Projects, the hospital has become a symbol of the state's commitment to extending tertiary-level medical services to the southwestern region. The CHRU is being designed as a full-service regional referral hospital with a planned 300-bed capacity, making it among the largest hospital complexes in West Africa. The cost of construction has been cited at over 45 billion CFA francs, and the size and scope place it firmly in the massive category of healthcare investments. The decision to locate the facility in Gaoua responds to long-standing concerns about limited access to advanced medical care across Burkina Faso's southwestern provinces, where major hospitals have historically been concentrated in Ouédraogo and Bobo-Dioulasso. This CHRU aims to bridge that gap by providing surgery, internal medicine, diagnostics, intensive care, obstetrics, emergency services, and more. During his visit on August 2nd, Prime Minister Ouédraogo toured the active construction zone, reviewing progress reports with engineers and construction teams. He spoke with project managers from Ellipse Projects and local officials, underscoring the government's insistence on adhering to a strict timeline and high-quality benchmarks. Observers reported that Ouédraogo affirmed state support for accelerated work and adequate resourcing to keep the project on schedule toward its expected delivery in 2026, though no formal public deadline has been confirmed yet. In addition to basic structural milestones, concrete foundations and utility infrastructure, including roads, drainage, and water systems, are well underway. By late July 2025, contractors were advancing both construction of clinical wings and supporting facilities such as diagnostic laboratories and administrative buildings. A separate tender for the dialysis unit's water evacuation pipeline, published July 25, 2025, reflects the advanced planning to equip the hospital with advanced renal care capacity, a feature rare outside the capital. The facility sits on a well-located site accessible by the main transit routes serving Gaoua and surrounding towns. Infrastructure access was a key selection factor, designed to streamline patient transport and logistics. This location and planned internal circulation aim to support a high throughput of outpatients, inpatients, and emergency cases. A cornerstone of the hospital design includes intensive care units, one of the first in the region, and operating theaters with modern equipment. The National Health Strategy calls for 5 intensive care units at newly launched hospital campuses across the country, and Gaoua is among the early prioritized sites. The government's broader healthcare investment plan includes launching as many as 55 new hospital facilities nationwide. Gaoua's Regional University Hospital is positioned as one of the flagship centers in this infrastructure surge. Across other regions, local hospital projects include primary and secondary facilities, while Gaoua's CHRU is envisioned as a tertiary hub, equipped to handle complex surgical, diagnostic, and specialist care demands, as well as serve as a training location for doctors, nurses, and allied health professionals. Local reaction to the project has been enthusiastic. Regional authorities and community members welcomed the Prime Minister's visit as a milestone moment, reflecting that the hospital had moved from promise to tangible progress. Social media commentary and regional outlets described the CHRU as a long-awaited facility finally in full construction, expressing relief that the southwestern population may no longer need to travel extensively for tertiary health care. Ellipse Projects, the contractor, has a portfolio of large-scale development projects across West Africa, including hospitals, educational campuses, and infrastructure works. Their website lists the Gaoua CHRU as one of their major ongoing achievements, remarking on its size, technical complexity, and strategic importance to Burkina Faso's healthcare reforms. The firm has reportedly employed modular construction techniques and imported specialist hospital equipment, coordinated with local construction teams and government oversight. This synergy is intended to ensure quality control while building local capacity in hospital engineering and operations. The timeline reflects a multi-phase delivery model. Initial groundwork, including land preparation, excavation, and primary utilities, began earlier in 2025. Structural shell and roofing phases have progressed in midsummer, with interior outfitting and equipment commissioning expected to dominate late 2025 and early 2026. Supporting infrastructure, including lodging for trainees, transportation links, and staff housing, is also part of the master plan and being advanced in parallel. The financial dimension is notable. A budget exceeding 45 billion CFA, $175 million USD depending on exchange rate fluctuations, places it among the most expensive public health investments in Burkina Faso in recent memory. Funded primarily through state budget allocations and potentially supported by international donors or technical partners, possibly including Chinese construction cooperation as implied by reports of bilateral collaboration. This aligns with broader patterns of Chinese-African infrastructure cooperation. Beyond sheer scale, the hospital is designed around sustainability targets. Solar power integration, water recycling systems, and waste management facilities are reported elements of the plan, though final commissioning details remain awaited. Its role as a teaching hospital implies integration with regional academic institutions. It may host medical students and residents, offer continuing education for health personnel, and support public health research in areas endemic to the region such as malaria, malnutrition, and maternal health complications. In his August 2nd field visit, Prime Minister Ouédraogo emphasized the hospital's potential transformative impact, enhancing healthcare equity, reducing patient travel costs, and boosting regional economic development through job creation and procurement from local suppliers. He urged the local administration to coordinate smoothly with the Ministry of Health and the implementing contractor, and promised continued political attention to ensure deadlines and standards are met. The broader context is compelling. Burkina Faso, like many Sahelian nations, faces a significant healthcare gap outside major urban centers. By situating a high-capacity referral hospital in Gaoua, the government is addressing critical regional disparities. The new center signals a shift toward decentralization of specialized healthcare services and reflects lessons learned from existing referral hospitals in Bobo-Dioulasso and Ouagadougou, where demand often exceeds capacity. While the Bobo-Dioulasso CHRU delivered early in 2025 has already relieved some pressure, its reach remains limited, making Gaoua's arrival important in geographic coverage. The success of the Gaoua CHRU hinges on several factors. Construction quality and adherence to schedule are first among them. Delays or cost overruns could impact public trust and the viability of healthcare delivery. The integration of specialized equipment, particularly for radiology, intensive care, and dialysis, will require advanced logistics and maintenance systems. Staffing is another critical component. Recruiting and retaining specialized medical personnel in regional centers may challenge the national health system, though the teaching hospital dimension may help by training local graduates. The CHRU is also expected to play a key role in handling health emergencies, outbreaks, and referral needs for surrounding rural areas. It will serve as a hub for ambulance networks, referral transport, sophisticated diagnostics, and surgical interventions that previously required travel hundreds of kilometers. By combining advanced inpatient care with outreach and public health programming, it aims to serve as both a delivery and coordination point for regional medical networks. Prime Minister Ouédraogo's visit served to highlight political will and state presence, reinforcing the fact that this is not a symbolic project, but one backed by ministerial oversight, budget commitments, and operational planning groundwork. His presence on site confirmed to local officials and the public that the CHRU is moving forward with urgency. The announcement of progress came amid widespread national infrastructure ambition, including multiple hospitals, clinics, and health posts across the country, placing Gaoua at the forefront of tertiary-level expansion. In sum, the Regional University Hospital Center of Gaoua is more than a hospital. It is a strategic healthcare anchor for southwestern Burkina Faso. With a capacity of 300 beds, intensive care capability, dialysis facilities, and teaching functions, it encapsulates the state's vision of decentralized tertiary healthcare. Prime Minister Ouédraogo's field visit on August 2, 2025, underscored governmental commitment to driving the project forward, ensuring quality, funding, and coordination remain aligned. Construction progress through mid-2025 reflects a multi-phase rollout involving infrastructure foundation, structural builds, and early utility installations. While final delivery timelines await confirmation, all indications point toward a likely handover in early to mid-2026. If successful, the CHRU in Gaoua will fill a critical regional health gap, reduce patient burdens, improve outcomes, and bolster the long-term training capacity of Burkina Faso's medical workforce. The scale and ambition place it among the country's flagship investments in public health infrastructure, signaling a transformative step in national efforts to build more equitable, modern healthcare systems beyond the capital region.